Welcome back here on the news track. The central government has made the Aarogya Setu app mandatory for all government and private office goers. While the government says the app is India's Brahmastra in the fight against the coronavirus, the opposition is raising serious concerns about data privacy. I'm joined at this moment by K. Vijay Raghavan. He's the Chief Scientific Advisor to the Government of India, has been closely involved in the Arogya Setu project. Before I go across to Professor Raghavan, I want to show you a reality check that we did on the first day of lockdown 3.0, where we tried to get a sense of whether office goers knew they needed the app. It's now been made compulsory, which means anybody who's watching right now, when you step out, especially if you get home, leave home to reach office, it's now mandatory to have the Arogya Setu app on your phone. Here's a reality check.
Arogya Setu app is being touted as India's Brahmastra in fighting the coronavirus pandemic. The centre has made the contact tracing app mandatory for all employees, both private and government. It is also encouraging citizens to download and use its location and Bluetooth-based mobile application. India Today conducted a reality check on day one of lockdown 3.0.
Did your management send out any letter? Did your management send out any communication? Because now the government is saying anyone who's working should have it.
Initially only we downloaded by ourselves, but our organization has also advised us to download the app. We have got official mails to download the app.
मैंने डाउनलोड करने का तो सोचा था, पर कुछ लोगों का ऐसा कहना है कि उससे प्राइवेसी लीक हो रही है और मतलब जो भी हमारा डेटा है वो गवर्नमेंट उसको डिटेक्ट कर रही है, तो इस वजह से मैंने डाउनलोड नहीं किया.
All police personnel on duty have downloaded the app. The app alerts users if they come in contact with COVID-19 patients. Using Bluetooth and GPS tracking, it pinpoints the location of the user and calculates the risk of infection based on proximity to any patient. The app also provides useful instructions in combating the viral disease. The government is likely to use the app to issue e-passes to facilitate travel from one place to another.
Through the app, we can catch the disease, we can catch the virus, even though it is trying to spread insidiously through asymptomatic people. That's why you should download the app.
The Congress is calling the app a sophisticated surveillance system, a charge vehemently denied by the government, which asserts it has a robust data security architecture.
Now Google has come out with such an app. So world over, this app is being preferred over other means of tracking. I think that's a base scientific instrument. There is nothing of privacy related matter or any information to be collected. There is no information.
Activists say that user consent, a fundamental principle for digital privacy, has been rendered meaningless with the centre making the Arogya Setu app mandatory for a large section of people. Maybe desperate times call for desperate measures. With Arvind Ojha, Himanshu Mishra and Gaurav Sawant in Delhi, Bureau Report, India Today.
To understand the privacy settings of the Arogya Setu app, I'm joined by K. Vijay Raghavan, Chief Scientific Advisor to the Government of India. And after Professor Raghavan has spoken, to provide a counter view, I'll have Nikhil Pava. He's a digital rights activist, very closely involved in the Net Privacy Project. So first, Professor Raghavan, there are huge concerns about privacy. Now, ordinarily, there'd be a raging debate over whether people should download the Arogya Setu app, about whether they should be made compulsory, but we're in the middle of a pandemic, and naturally, health and public health supersedes all other concerns at this moment. What can you tell everyone who's deeply concerned about their privacy being violated, about the privacy norms that are applicable in the Arogya Setu app?
Yeah, thank you very much, Rahul. The issue is not of safety versus privacy. It's how one can have safety and privacy. And both are there. Let me address the safety issue. Why do we need contact tracing and why do we need digital contact tracing? Digital contact tracing allows a positive to be identified, and not only their immediate contacts being identified, but their previous contacts over recent times. And this is very important because the disease also spreads pre-symptomatically and asymptomatically. And therefore, this is a social commitment which all of us must have to enable digital contact tracing until such time as we have a vaccine, and that will take some time to be made and then to be implemented. And therefore, this provides, if it's done fast and it's done well, then it provides digital immunity. So safety is important. Now, privacy is also important, and this app does not compromise privacy. Your data is stored on the phone. Unless someone becomes positive, then their data goes to a server, and it's used only for COVID-19 related work and for nothing else. And that data is deleted in the following manner. So information of all unique interactions is stored only for 30 days on the device, post which that data is deleted. For all data stored for non-risk users, data is deleted in 45 days. And for at-risk patients, data is deleted in 60 days. Your location data is used in the event you have tested positive for COVID-19, only to map the places you have visited in the past 14 days. It doesn't track you, everywhere and so on and so forth. And this is in order to identify the locations that need to be sanitized and where people need to be more deeply tested. So the location data is not used for anything for any other purpose. You must keep in mind safety and security use 5 principles. Need to know. Only when the person is infected is the data goes to the servers. Encryption is fully there. Removal of information when it's not needed. There's transparency and consent, and data should have maximal automation and very little human intervention. So all these points have been addressed.
So I want to take up a few follow-up questions. The government first said that there'll be a liability for data being misused or breached. That was then taken back. Questions are being asked about why. You haven't clearly defined who in government has access to the data that is collected. This hasn't been made available to private security researchers to test whether all the claims that you're making are actually true. Should you not look at that, and why is that not being done? Shouldn't the scope of the Arogya Setu be limited, and can it not be made non-mandatory? Respond to those concerns.
See, the point to be addressed is the following. How does digital contact tracing work? For someone to get digital immunity, for a crowd to get digital immunity, a certain number of people need to use the app. Otherwise, it's pointless that one person having the app and carrying it around with their personal contacts, it doesn't help at all. Now, if 20% use it, there's a certain benefit, 30% there's more, and if there's 80%, there's substantial benefit. So the more people use it, it actually works much, much better. The security and the privacy has been tested by multiple agencies, and the source code will be made public. The documentation of that is getting ready, so you should see the source code also, and anyone who wants to test it can test it. That will also happen.
Nikhil Pava, that's an important clarification from the government that the source code will be made public. Secondly, it is logical and intuitive to say that if only 30% of the population is using the Arogya Setu app, it doesn't serve any purpose. If this is to be a security cover, you need to ensure that the maximum number of people are using it. Even if only 50% are using it, the next 2 guys could have COVID-19, and how would we ever find out? Therefore, it is in public interest in the middle of a pandemic. Public health overrides other concerns, and there is a sunset clause built in about how long that data will be stored. Respond to the scientific advisor, Nikhil Pava.
So Rahul, I don't think there's a sunset clause for the app built in. Prakash Javadekar said a couple of days ago that this app will continue for 1 to 2 years. And one of the things that we've seen is that more and more things are being added to this app. So its scope is expanding beyond what is necessary. If indeed it is necessary and useful for contact tracing, which I have my doubts about, and I'll explain why, its scope is being expanded to include e-pass. There is telemedicine, which is currently being piloted using the same app. And what are the terms for that particular data? If you have an e-pass and you basically give your ID, which is then linked to your other data, even when it comes to anonymization of the Bluetooth data as well as the location data, it's linked to a single DID and not a dynamic ID, which the Singapore Trace Together app has used, which Google and Apple's app is also using, where the IDs change every 15 minutes so that it can't be linked back even if the data leaks to an individual. I appreciate the fact that it's going to be the source code is going to be made available, but for now, anyone who tries to re-engineer the app, it's illegal for them to do so under the current privacy policy, which should have never been there. And despite several requests, so far it's not been open source. The other issue is that no one has liability if there's a data leak. What happens, like in case of Aadhaar, where data kept leaking, who's liable? Who's the authority that's managing it? Why don't we have...
No, but some of these are relevant concerns, Nikhil Pava, but we must also keep in mind that there is a pandemic raging and the government is building the app in real time. It's like trying to build an aircraft when you're flying it.
So Rahul, here's the thing, right? In a pandemic, you have to act quickly, and we understand those concerns. But it can't be an all or nothing approach to privacy. It can't be that the moment there is an emergency, an exceptional situation like this, you don't have the right to rights if you don't have an Arogya Setu. That's what we used to say about Aadhaar. The same thing is happening over here. You don't have the right to movement unless you have Arogya Setu. Now, on the efficacy of Arogya Setu, it uses Bluetooth. So if you and I are on different floors of the building and we're both standing in our balcony, that will show us as being in contact because Bluetooth pervades walls. Now, across up and down floors in most buildings, in most offices, it will show people, there'll be so many false positives over there.
Okay,
that
let's deal with false positives. Now, somebody in our office downloaded the Arogya Setu app and it showed that there was somebody who was COVID positive about a kilometer away. Now, that spooked everybody. And suddenly you're wondering, okay, now where in this 1 kilometer is somebody who has COVID-19? Professor Vijay Raghavan, respond to the concern around false positives. If this becomes your e-pass and for some reason linked to technology, it's almost as if it shows that, okay, that guy has COVID-19, he becomes a pariah and everybody's running in the opposite direction, could spook and scare everyone. How do you respond to those concerns, sir?
Well, there are three important points here. First of all, when someone is positive, the fact that they are positive is not publicized to any one of their contacts. That person knows it and no one else does, but the contacts are alerted in a region to be careful depending on the nature of their contact. That's number one. Secondly, again, I would like to stress, it is not a conflict between value of the app and privacy. Privacy is very important. Many of the comments made about privacy are very valuable and they have been already taken on board, and you will see dynamically that being taken care of, as I said earlier, including a dynamic ID, by the way. Now, third point, keep in mind what happened to Korea. In 2009, during the MERS epidemic, MERS, which has a very high case fatality ratio, Korea was shaken and it put in place extraordinarily high stringent measures of contact tracing, which are about several-fold more stringent than what Arogya Setu does. And that is not necessarily in our case, but Korea did that. And because of that stringent contact tracing, which include credit card use and other kinds of tracking, they were able, and that had full acceptance of the Korean people because of the value it brought in the case of a pandemic. Here we're not even compromising privacy and we're asking participation.
Now that's an important point you make, and Nikhil Pava, the reality is without locking down the country forever, the only way we can emerge from this lockdown is if those who are COVID positive or COVID suspect are traced and isolated, and the rest of the country that's at this moment COVID free is able to get back to work. So yes, there are concerns on privacy, but there's a larger interest in ensuring that all our companies don't go bankrupt, employees are not fired, there isn't blood on the factory floor. So there's a larger overriding public concern as well.
But Rahul, where is the proof that contact tracing in this particular instance actually works? Where where people are asymptomatic for a long period of time, and the fact with Bluetooth, like I mentioned, it pervades walls. So I may not have been in contact with someone, but it will still have shown me as having been in contact with a person who's positive. Those Bluetooth is ineffective in this case. So because of the false positives with that, and that issue has not been addressed by the gentleman, this is not going to work. We are unnecessarily invasive on privacy over here. And there's also this sense of tech solutionism that's going on, where technology is being seen as a solution to all these problems, where it is not, nowhere has it been proven that this contact tracing app is going to be effective.
Okay, can I show our viewers what happened internationally? So we looked at some of the other countries where similar apps were developed, and I think it's illustrative to step back for a moment, see what happened internationally, how similar apps were used by those countries to keep a very close eye on who was COVID positive, COVID suspect, and what the international example has been. Here's our report. Ankit Kumar with this story.
Protection or privacy? The debate is raging over India's Aarogya Setu app. The world is embracing contact tracing technology to fight coronavirus. Apps are helping authorities track the virus and warn citizens who may be infected to stay home or get tested. China, South Korea, Singapore and Taiwan have led the way in developing contact tracing systems. Singapore was among the first to roll out a contact tracing application. Trace Together was launched on March 20th, and more than 1 million people had downloaded the app by mid-April. The systems use Bluetooth with data crunched securely on each individual's phone. China launched a similar app named Close Contact Detector, accessible by scanning a QR code through platforms such as QQ, Alipay and WeChat. The app allowed people to identify whether they are at risk of being infected. South Korea not only asked citizens to recall their movements, it used credit card transactions, CCTV footage and mobile phone tracking to piece together where they had been. Taking a cue from these countries, others too are rolling out progressive versions of contact tracing apps. Australia and Israel have launched their apps, while United Kingdom and other European countries are developing similar applications. United States is also expected to roll out its contact tracing technology by next month. But how these apps work differ from country to country. While China has the strictest contact tracing regime, where it strictly uses personal data to control movements, Singapore, South Korea, India have a lower level of data surveillance. World's two biggest tech giants and competitors, Google and Apple, have announced they will be joining hands for a common interface that will help governments across the world track coronavirus infections. The API will pick up the signals of nearby phones at regular intervals and store the connections between them in a database. If a person in the database is tested positive, their past contacts can be traced.
What they're trying to do is solve a problem with an invisible, fast-moving killer that you need technology, a lot of people believe, to tackle, because so many people who are infected with the virus aren't showing symptoms, and they're transmitting it that way.
But does all this tech tracing mean that your personal data will be at risk? The privacy experts say the question now is, what takes precedence? Protection or privacy concerns? And will there be a pushback? Your report, India Today.
K. Vijay Raghavan, Chief Scientific Advisor to the Government of India, I have a simple question. What if somebody who's COVID positive or a COVID suspect leaves the phone behind? A lot of this is really based on people's own participation, because if you leave the phone behind, there is no way that you can trace the person. He could be roaming around the marketplace, having ice cream or doing what he must, and nobody really knows what's going on. So how do you deal with these kind of issues? I want to show you what Yuval Noah Harari said. Yuval Noah Harari came on the India Today e-conclave, and he thinks that we need to think deeply about these issues. Of course, working on ensuring we have an effective app is important, but we also need to keep in mind concerns around privacy, so that this has a fixed sunset. This is here for this period. After that, it's gone. We can't allow for such an app to ultimately move towards the direction of being a surveillance state. Here's Yuval Harari. At this moment, if you ask people to choose between concerns about their privacy and concerns about public health, most people who are watching you would pick health. How do you ensure that the totalitarian surveillance, the ubiquitous sensors, the powerful algorithms, the under-the-skin surveillance that you're talking about come in only as a temporary measure and don't become a part of the new normal?
The problem with emergency measures, they tend to stay forever, because there is always a new emergency. The government could say, well, this is just for a few months to deal with coronavirus. But even when coronavirus is down to 0, they will say, wait, but there is a second wave coming, so we have to be prepared. And maybe there is a new Ebola epidemic or a new flu, and we will keep it. So the danger is there. And in order to prevent it, people should realize they shouldn't have to choose between privacy and health. They should have both. When I go today to my family doctor, I don't have to choose between health and privacy. In order to get good medical care, I give the doctor a lot of private information about my medical condition, my habits, even my sex life. If there is some sexually transmitted disease, the doctor might start asking me questions about my sex life, things that I don't even want my husband or wife to know. And I trust.
And I think Professor Harari makes an important point. I'm very glad to have heard what Vijay Raghavan said, that the government is listening and they're willing to make changes as well, from a static ID to having a dynamic ID, listening to some of the ideas that privacy experts are making and incorporating them, and also making this an open source code so that others can see the architecture and can test it as well. So I'm very glad to see that kind of a positive approach from Vijay Raghavan, because ultimately the battle is being fought together, and either we win or we lose, we live or we die, we do it together. And it's good to see the government say that they are willing to listen and make changes as we go along. Professor Vijay Raghavan, for joining us with your insights and showing such an accommodative stance, thank you very much. Thanks also to Nikhil Pava for raising the concerns around privacy, both equally important. Privacy plus health, focus on both, it's not one versus the other. I want to end.
Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.